Welcome to our high-yield NORCET review. High-yield questions can feel overwhelming, but they're really about understanding connections in medicine. Today we'll break down key questions, reveal the logic behind them, and help you build a framework for exam success. Let's dive in. First up, heparin. This medication is a staple in hospitals and clinics around the world, but what exactly is it? Many people know heparin as a blood thinner, but its true nature is a bit more complex and fascinating. Is it a protein, a lipid, or something else entirely? The answer might surprise you, especially if you're new to biochemistry or pharmacology. The answer, heparin is a glycosaminoglycan, or GAG for short. This means it's not a protein or a fat, but rather a long, complex carbohydrate molecule. GAGs are made up of repeating sugar units, forming long chains that are highly negatively charged. This negative charge attracts water, making them extremely hydrophilic. Because of this, GAGs play a crucial role in the body's connective tissues, providing both lubrication and structural support. You'll find them in places like cartilage, skin, and even in the fluid that cushions your joints. But what really sets heparin apart is its powerful anticoagulant effect. In medicine, it's used to prevent dangerous blood clots from forming, especially in patients at risk for conditions like deep vein thrombosis or pulmonary embolism. Heparin works by activating a protein called antithrombin 3. Once activated, antithrombin 3 inactivates several key clotting factors, including thrombin and factor XA. This action interrupts the clotting cascade, making it much harder for blood clots to form. By preventing the formation of fibrin clots, heparin is essential for treating and preventing life-threatening conditions like DVT and pulmonary embolism. It's a lifesaver in surgeries, intensive care, and many other clinical situations. So, remember, heparin is a JAG, and its unique structure is the key to its function as an anticoagulant. Its long, negatively charged chains are what allow it to interact so effectively with antithrombin 3. Understanding this connection between structure and function helps you appreciate why heparin is so important in clinical practice. It's not just about stopping clots, it's about harnessing the power of biochemistry to save lives. Now that you know the science behind heparin, let's move to the next question. Here's a fascinating question. Which tissue in your body doesn't need insulin to absorb glucose? The answer might surprise you, it's the brain. While most of our organs rely on insulin to help glucose enter their cells, the brain operates differently. Most cells require insulin as a key to unlock the door for glucose, but the brain uses special transporters called GLUT1 and GLUT3. These transporters are always active, allowing glucose to flow in freely no matter what. The brain's energy demand is relentless and constant. It can't afford to wait for insulin signals. Every second, billions of neurons are firing, and they need a steady supply of fuel to keep you thinking, moving, and feeling. That's why, even in diabetes, when insulin is low or cells become resistant, the brain still gets the glucose it needs. This unique system protects your most vital organ from energy shortages. Think of it as the brain having an open-door policy for glucose. No matter what's happening with insulin elsewhere in the body, brain cells stay fueled and ready to work. This is a crucial concept for understanding diabetes and why the brain is protected during metabolic emergencies. Up next, we'll explore how nutrition ties into this remarkable system. Which food is the best source of vitamin B12? Look for animal products: meat, fish, eggs, dairy. Plants don't make B12, only microorganisms do, so animal foods are the main source for humans. This is crucial for counseling vegetarians and vegans who may need supplements. B12 is essential for DNA synthesis and nerve health. Deficiency can cause anemia and nerve damage. So on the exam, pick the animal product for B12. Let's talk about wound healing next. For a patient with a stage 4 pressure ulcer, which diet helps most? High protein. Protein provides the amino acids needed for new tissue and collagen. Without enough protein, wounds heal slowly and poorly. Carbs and vitamins matter, but protein is the foundation for repair. Always think high protein for severe wounds or burns. Now let's tackle swallowing difficulties. Stroke patient with garbled speech. What diet is safest? Mechanically altered food with thickened liquids. Dysarthria often means dysphagia, raising aspiration risk. Thickened liquids, nectar or honey consistency, and soft foods help prevent choking and pneumonia. A speech-language pathologist will guide the exact texture. This is a key nursing intervention for safety and nutrition. Next, a public health question. What is 2-in-1 salt? It's table salt fortified with both iron and iodine. Iron deficiency causes anemia. Iodine deficiency causes goiter and brain damage. Fortifying salt tackles both problems in one simple, cost-effective step. Microencapsulation keeps the nutrients stable until consumed. Salt is the perfect vehicle since everyone uses it. Remember, 2-in-1 salt equals cyan iron plus iodine for public health. Which technique separates proteins and nucleic acids? Electrophoresis. It uses electricity to move charged molecules through a gel, separating them by size and charge. DNA moves toward the positive electrode, smaller fragments travel faster. This is the basis for DNA fingerprinting, protein analysis, and diagnostics. Think of it as a molecular race powered by electricity. Next, a question about structural proteins. Alpha-keratin is found in hair, nails, and the outer layer of skin. Its strength comes from its alpha helix structure, coiled coils, and strong disulfide bonds. This makes it tough, flexible, and resistant to damage. It's also found in animal claws, hooves, and feathers. Remember, alpha-keratin equals sign tough, protective protein for body coverings. Now let's talk drug metabolism. Which drug route faces hepatic first-pass metabolism? Oral. Drugs taken by mouth go through the liver before reaching the rest of the body. The liver can break down much of the drug, reducing its effect. This is the first-pass effect. IV, sublingual, and buccal routes bypass the liver, increasing bioavailability. Always consider the first-pass effect when choosing drug routes. On to our last pharmacology concept. What does efficacy mean in pharmacology? It's a term you'll hear often, but it's important to understand exactly what it refers to when discussing medications and their effects. Efficacy is a key concept that helps us compare different drugs and decide which one is best for a particular situation. It's the maximum effect a drug can produce, no matter the dose. Even if you keep increasing the amount, the effect won't get any bigger once you hit that ceiling. This is crucial when treating conditions that require a strong response, like severe infections or intense pain. Potency, on the other hand, is about how much drug is needed for an effect. It's a measure of the dose required to achieve a certain response. A highly potent drug needs only a small amount to work, while a less potent drug needs more. Efficacy is about how big the effect can get, regardless of the dose. It's the upper limit of what a drug can do for a patient. And it's especially important when the goal is to achieve the greatest possible improvement. A drug can be very potent but have low efficacy, meaning it works at low doses but can't produce a strong effect. Conversely, a drug might have high efficacy but require a larger dose to reach that effect. Both properties matter when choosing the right medication. For severe symptoms or life-threatening conditions, high efficacy matters most. You want a drug that can deliver the biggest possible benefit, even if it takes a higher dose to get there. On a dose-response curve, efficacy is represented by the plateau height, the highest point the curve reaches. This shows the drug's maximum possible effect, no matter how much more you give. Potency is shown by how far left the curve sits. The further left, the less drug is needed for an effect. This helps you quickly compare drugs on a graph. Knowing the difference between efficacy and potency helps you make smart therapeutic choices for your patients. Understanding these concepts ensures you select the right drug for the right situation. Let's wrap up. That's our high-yield review. We've covered everything from heparin to public health and pharmacology. Focus on understanding the why behind each answer for true mastery. Keep questioning, keep connecting, and you'll be ready for NORCET and beyond. Thanks for watching. Don't forget to like, subscribe, and stay curious.